Good morning, friends. We are here at Friday, February 6th, and again, there is a lot going on. I say that every week, and it's always true. So, we're going to start with Wisconsin's legislative session. If you are here from another state, take a breather, get a second cup of coffee. We'll be doing federal stuff after this. But this is frantic season, sometimes called silly season in the legislature. And if you happen to be in the Capitol, you may see lots of people who are hurrying around looking rather kind of stressed out. Many of them are lobbyists who are desperately trying to figure out how they can get a bill amended or moved forward, or if they're about to see all of their dreams die and have to wait for until next session to try again. This week was probably the last full week where you had public hearings in the Assembly. Remember, the Assembly has been consistent about saying it wants to end its session 2 weeks from now in February. So if you have a bill in the Assembly, you need to have a public hearing and you need to have that committee hold an executive session on that bill in order for it to be in the right place in the process to get it scheduled for a full Assembly vote. And so if any of those steps don't happen, the bill can't pass and it can't become law. So it's still possible to have public hearings next week with very short turnaround executive sessions. This is the time in the season where often hearings are announced with 24 hours notice. And as you get closer and closer to the end of the session, things pick up the pace. So it's still possible to have a public hearing and then the next day have the same committee do an executive session. I have seen many crazy things happen. But we are now getting to the point where if things don't happen soon, they're likely not going to. The Assembly is expected to have 2 floor votes next week and 2 floor votes the following week, and then it's going to be done. So whatever hasn't passed the Assembly at that point is not going to move forward. And the Senate is planning 1 floor vote where all the senators come together next week, and a second one likely after the Assembly ends its session. I'm going to pause and talk a little bit about tax cuts because there are some rumors in the building that there may be some discussions happening about what should Wisconsin do more tax cuts in exchange for other things that might be wanted, like funding for certain things like special education, for example. And tax cuts have been something that this state and other states have done. And it's important we've been kind of conditioned to say, oh, tax cuts mean something good. But tax cuts are really a way states reduce the amount of money that is coming into the state treasury, which reduces the amount of money states have to spend on public programs and services. So when you think about a tax cut, you should think about less money coming in for the state to spend. And there are a number of national kind of budget watching groups, Pew Trusts and State Line and others, that have pointed out that there are many states who have perhaps relied on lots of federal dollars and have had revenues that have been over what they expected, and they have then decided, because they got more money in than they thought, that they would do some tax cuts, which tend to be politically popular, even though many of us don't see a huge reduction in our bill, in our tax bill. So what that means is that states that have done tax cuts when times were good now are in a place where if times don't stay good, they all of a sudden are receiving a lot less revenue as costs have gone up for programs and as potentially the economic outlook goes down. So when states have less revenue than what they have to pay, or and more costs to pay than what they currently do, they can either decide to do less. If you don't have enough money to pay for what you're doing now, you can decide to do less, which means eliminate programs or cut services. You can cut programs or you can increase revenue, right? And there's various ways to do that. Taxes are, and there are lots of kinds of taxes, income taxes, property taxes, sales taxes, for example, that all of us pay sometimes without knowing it. There are fees that are used as revenue generators and bonds. So there are different ways for states to raise money, but taxes are the main one. For projects or programs. So this is somewhat familiar to many of you who've attended these webinars because it really is what we've been talking about the last year as the federal government has decided to make tax cuts and then made other decisions about how are they going to offset the money that would have been coming into the federal government that they know they won't get because they made the tax cut. And for HR 1 is an example of that. That essentially was a tax cut bill. And the amount of revenue that the federal government now knows it won't get in because it made the tax cuts, it offset with $1 trillion in cuts to Medicaid and to SNAP and other things. So I just want folks to know that, again, there are some rumors that Wisconsin, which is one of the states that has done tax cuts kind of pretty much for the last couple of sessions, may be thinking about trading tax cuts for some other spending. And they may be doing that because they think revenues are higher. And I think there's reason to believe that when you do a tax cut, you are actually putting yourself in a position which makes it more likely that you will have to cut programs and services more later if economic conditions change and because we already know that there are cuts coming from the federal level. So we have an example later in the presentation of a state that is in exactly that position. And Idaho is the state we'll be talking about. And they are now in the position where they are making a tax cut, which will mean less money. And they are now cutting programs that are, or making recommendations to cut programs that will directly impact people with disabilities to offset the money that they're no longer getting in. As a reminder, Wisconsin is in a position where even though the revenues that the state is projected to get in are higher, we know that there are an awful lot of items that the state budget currently says it wants to pay for that don't have enough money. So even though the story of we're getting in more revenue than we expected sounds good, when you start saying, okay, but we have a $70 million upper for food share, we have a $140 million shortfall for year one of the state budget for special ed. And remember, we don't know what the shortfall is going to be for year two of the state budget, but it is likely if the legislature did not set enough money aside to meet the reimbursement rate for special ed for year one, that will continue to be true in year two. So you look at that $140 million and realize that that's the first year. There will be probably another shortfall of unknown number the second year. And we were supposed to raise the reimbursement in the second year from year one. So it's likely to be at least the same or perhaps higher. You have an $11 million shortfall already in DVR, $213 million shortfall in Medicaid already, and then a couple of outstanding items. One, the fee-based revenue for a number of programs is not sufficient to fund what we're doing now in this current budget, and then some pretty big unknowns. If you add up the top line on this graph, you are at least $500 million short. And that likely is a number that should be higher because we don't know about what the shortfall for special education in the second year will be. And then you look at the bottom number, and if those things come to true, that's almost almost $1 billion. So we had a $1.5 billion revenue more in projected revenue. But you look at these numbers and you're already minimum $500 million short from what the budget said it wanted to pay for now. And that number might be a lot bigger. So that means that the extra revenue you thought you were getting in really isn't there if you actually want to pay for what you promised for in this current budget and avoid risk of not having enough money to pay for things for unexpected events. So at this point, Survival Coalition has sent a letter to all members of the legislature saying, hey, let's have a public hearing on those bills that would fund special education to the level promised in the state budget. This is a public response and call for this because we know that if these bills don't get a public hearing, they have no path to pass. So this is the moment where you make this ask of the legislature, and it's either going to happen or it's not going to happen. If it happens, then you press for the next part of the process. If it doesn't happen, then it will be time for advocates to say and talk about the consequences of not sufficiently funding special education to students with disabilities and families. A lot of times in advocacy, even if you think you know what the outcome is, you do the things at the right time to put yourself in a position to do more things that could get you a different outcome the next time. Okay? So lots of these things that I'm going to talk about right now are the things that advocates all need to do to tick the boxes, to make sure that members of the legislature don't have an excuse that they've never heard about this issue, right? They know now. We sent a letter. Many grassroots advocates have contacted folks about these bills. This is another opportunity for grassroots folks to contact people about these bills, and it demonstrates that we and you are watching, and we are going to see what you do or do not do, and we will have something to say about it based on what action is taken or not taken. So lots of this stuff in the very end of the session, it may feel futile, but it is absolutely essential. And it's critical work that's often neglected, but it's essential to set yourself up for the next time. Remember, these two bills would not exist except that, frankly, disability advocates threw out a press release and got a lot of media coverage on this issue. That is the reason why a lawmaker said, oh, here's the thing that I want to write a bill on. Even if these bills don't pass, that is a huge win. And now we are in a position where we can continue elevating and giving visibility to the issue because those bills exist and because there is now a way to show whether the legislature is acting or not acting on those issues. Similarly, Survival Coalition has sent a letter to all members of the legislature again about DVR and the need for joint finance to hold a so-called 1310 meeting to approve the additional money that DVR needs so we can eliminate the wait list for job services for people with disabilities. Again, advocates pushed, the department wrote a 1310 request. Because that request was written, it meant that we could contact the co-chairs of the committee. When we didn't get a response quick enough, it meant there was another communication. And now we're at the point where, again, we need to elevate and make sure there are calls going in so that there is some reason for lawmakers to believe that not taking action on this issue does have consequences, that there are people watching and observing and following what they do or don't do on it. Similarly, a different coalition of groups, of which Survival Coalition and our board and other disability orgs are part of, is doing a similar approach this time. They have a draft release, and there may be a press conference next week, all pressing on the need for additional money for food share to implement the changes required by HR 1, and to make sure that when the federal administrative funding is decreased in October, that we don't create another larger budget hole that's unfilled. So again, similar approach. We are elevating the issue to legislators, elevating it to media, maybe doing an event on it, to try and demonstrate that people are watching what legislators do and what they don't do. There are a couple other bills that we have been following, so I'm not going to go through them here, but you can see some of them are moving farther through the legislative process, and some of them are staying where they are. One bill that did have an executive session that a lot of folks have been following are the bills that would make it easier for teachers to kind of choose who they want in their class and exclude other students. That bill was heard for a public hearing 2 weeks ago. This week, there was an executive session and it passed out of the committee, which means now it's available for scheduling. And one of those bills had already passed the full assembly. So that means that if the Senate schedules a vote on those bills, then, it is in the position where if they pass, it will go to the governor's desk. That's pretty close to being in a position where, you might still have a pathway to becoming law. Moving to Congress. Last week, we were talking about a shutdown, and that happened. On Friday last week, we had the Senate and the House not be able to agree on the remaining 6 federal budget bills. And as of midnight, the government closed down. On Tuesday, the House came back into session, and the House basically agreed to what the Democrats had proposed, which is we will approve 5 of the 6 remaining appropriation bills and then have a separate vote on the Department of Homeland Security budget bill and extend funding for that agency for about 2 weeks while we continue to negotiate details. So it's good news in the sense that we have avoided the kind of shutdown scenario we had this fall. And the 5 budget bills that passed this week include the labor DHHS and education bill, which funds a lot of programs that are really important to people with disabilities. It also includes the transportation and HUD housing budget bill, which also has a lot of programs important to people with disabilities. So all of the budget bills that have the most stuff in them, most of the agencies that do the things that really impact people with disabilities, they now have a permanent budget through September 30th of this year. Okay. The president did sign those bills into law, and the only budget bill remaining is for the Department of Homeland Security. There's a continuing resolution in place for that agency that expires February 13th. Mostly, the reason that that budget bill is still not passed is because of concerns on how Immigration Customs Enforcement and Border Patrol has been operating and conducting themselves. So there are a number of changes that Democrats have said these are the things that we want to put into the law that say what you can and cannot do if you're one of these kinds of agents. It is not clear whether the Republicans will agree to any of those items. And already Congress is saying, well, we may not be able to come to agreement before the CR expires, and we may have to pass either another short-term stop to continue funding the agency or pass a year-long CR. Now, this department funds other things besides Immigration Customs Enforcement and Border Security. It also is where the Emergency Management, FEMA, is housed, and I believe the Transportation Security Administration. So if you fly and you have to go through security, that's also through this. So the Department of Homeland Security does a number of things that aren't the specific items that are being focused on. And it's also important to remember that HR 1, that reconciliation bill that passed last summer that had all of the cuts to Medicaid and SNAP in it, also had a funding increase for the Department of Homeland Security that's $170 billion. So it's important to remember that just because the 2026 annual appropriation has not passed for this agency, that it is able to continue operating at least with ICE and Border Patrol because it has separate funding that has already been authorized by a different law, HR 1. But we're going to hover on some of the wins here because you might remember in May, there were lots of ideas that the president proposed in his version of the budget that would have really changed and cut and harmed a lot of programs and that impact people with disabilities. So a good portion of the victories here, and they are victories that our grassroots really owns because people like yourselves across the country made a lot of calls and raised a lot of concerns. They're not reflected in that budget. Congress did not do what the president was proposing. They didn't block grant IDEA special education programs to states. They kept the structure of the Department of Education in the statutes. They funded developmental disability councils like our board, USEDS, like the Weissman Center in Wisconsin, and some protection and advocacy programs. They're all level funded. And the Administration for Community Living still exists. This is all stuff that was really unclear last March if it was going to be gone completely or if it would survive. Congress also gave the Department of Health Services actually more money than it asked for. largely directed at health research. And you may remember last year in March, there were lots of cuts that kind of the administration did of its own, without the permission of Congress. And Congress is saying, no, we actually want to do more research. Part of what we're watching is, you know, that extra money has been given to the agency, but the agency is the one who decides what projects it wants to fund and where the funding goes. And we've been following a little bit that last year, how funding was routed really changed. There were lots of projects that had kind of been long-standing that lost funding. There were new studies that were specifically around autism and new data collection that we were talking about that were really a different focus. They were focused on how do you figure out what causes autism and really framed about if we know what causes it, we can prevent it from occurring, right? So just because the agency has funding doesn't mean Congress, unless they have been very specific, can get down into the details and make sure it's funded on things that perhaps the disability community would say are priorities. The NIH also plans to give money to very different places than it has before. So we've talked before about how the current administration has been changing where money goes, and specifically withholding or stopping federal funds from going to states where they don't think that the people in charge of the state necessarily support the priorities the president has, and using federal money as a reward or a punishment. This is certainly something that NIH is telegraphing that it won't necessarily be giving, money to the places that have kind of grown to expect to receive it because they have pretty large labs, et cetera. So again, there's reason to believe that even though funding is level, it won't necessarily mean that Congress has complete control over how it's spent unless they exert their authority for oversight. So again, the four questions, we are in a place where now there is a permanent 2026 federal budget. That is good. We are in that budget at the same level of funding. That is good. That's better than the alternative. However, that doesn't mean Congress's role ends just because they've passed the budget and it's been signed into law. Now is the point where they have to watch and make sure that what they said they wanted done in the budget actually happens in a way that gets the money to the places that are expecting to receive it. The Affordable Care Act subsidies deal, we've kind of been talking about it's less and less likely, and it's kind of like you're watching a heart monitor, and it's growing, fainter and fainter, and it's just a matter of when does the line go flat. And I think we're pretty close to that. There were talks that continue about how can we reach some agreement on the subsidies. Depending on who you talk with, the Republicans will say we've made our best offer and the other parties are being unreasonable. The other parties will say, hey, some of what we've discussed in other meetings isn't reflected in the proposal that we see. The main thing is they were saying that if in December, they were saying, well, we can get this done and it has to be done by January 30th. January 30th is 7 days in the past, and there is no public legislative text that's been released. There's no timeline for getting an agreement. And we know that even the folks who are talking about the deal said if it isn't done by January 30th, it's not going to get done. So I think at this point, we can be prepared to be surprised, but it is highly likely that Congress, who said, oh, we can extend the subsidies at any time, that was part of the argument during the shutdown fight, they have now progressed to the point where that is not going to happen. And it has a lot of consequences we will continue to see and be following the next year. Um, Already, there's been 1 million people who haven't signed up for the ACA marketplace that were signed up last year. And there's a lot of articles here that are talking about the realities and the consequences of people who signed up but switched to a plan that covers less and requires more out-of-pocket costs. There's a lot of discussion about how healthcare pricing and and medical bankruptcy is a huge concern for many, many Americans, and what happens when you have healthcare that just you can't afford. There's also be prepared to hear Republicans now pivot to some rather tried and true messages. There is kind of a movement now that the subsidies have expired. The messaging is going to say, well, see, the whole law didn't work because it was supposed to make things affordable, and it isn't affordable. And the reality is, healthcare costs keep rising, and nobody has been willing to do really hard work to address some of the structural reasons why that keeps occurring, as well as Congress has been unwilling to do even the simple things like extending subsidies that would have made healthcare, at least the prospect of buying insurance, more affordable for many people. So the main story I think that we'll be watching is, again, how many people are losing their healthcare coverage. That number of 1 million fewer people is likely to rise in the coming months. There are lots of people that were automatically re-enrolled in policies, and they may not know how much their premiums are rising until they get their first bill. Then, if they don't pay that bill, and after a certain amount of time, they lose their coverage. So we should expect that these numbers are going to continue to go up as people decide that they can't afford health care and stop paying their premiums. And that will have some pretty big consequences down the road, both on state budgets, like our state, has, as more people leave the healthcare markets, especially if they are younger people or healthier people who need less care, that leaves the older and sicker people as being a higher proportion of the pool, which means the cost to cover those people goes up. And many states, including ours, have a reinsurance program that is trying to kick in state dollars to insurance companies to help cover, higher cost people in the exchanges. The other thing that is especially important in a state like ours is we have many, many more lower income people who are between 100% and 138% of the poverty level who are in the exchanges. In other states that expanded Medicaid, they would be in Medicaid, but they're in the exchanges here. So there is a higher likelihood that there are more low-income people who will discover they can't afford their premiums over the coming year and may drop out of the marketplace entirely. And where they go is an unknown question. If they are just uninsured or end up going, reducing their income to the point where they can qualify for Medicaid, because that's the only way that they can afford to get health care. So there's lots of folks that are already in a situation where they have very hard choices to make. And those choices that they make are going to put more pressure on either healthcare systems who have to figure out how to handle a higher population of people who are uninsured, or Medicaid if people go there. Um, and there are, I think, a lot of people who are, if we get any change in economic conditions for people, like if they lose their job, other things, people who are highly stressed in terms of being able to afford their premium, it makes it more likely that if any little thing goes wrong where their income is interrupted or goes down, they will be at a place where that healthcare bill may be the thing that has to go if they want to keep rent and food on the table. So, their Kaiser Health News has a rather helpful um, kind of, well, what do you do if you are now uninsured? And some advice on here. They're being very clear that the reason why we're going to have so many more people who need this kind of advice is because of the federal reconciliation bill that is cutting both the ACA and Medicaid. And that they're also being clear that health coverage of any kind is more helpful to have than not if you're trying to avoid major medical debt. So if you have friends who are struggling in this area, here is something you can pass on that gives reasonable basic advice about what to do if you are all of a sudden uninsured or underinsured. We have talked a little bit across the last year about voting and elections, and I think that this will be an issue in the spring that will become more and more in front of our eyes here. Congress recently introduced an election reform bill, and it is actually one of Wisconsin's delegation, Congressional District 1, Mr. Congressman Steele, who's one of the lead authors of this bill that would, almost put a federal lens over elections. So there's kind of two different bills that are happening, and some of them have they both have some similar ideas in them. The bill that Brian Stile has introduced, Make Elections Great Again, is the one that's on the right-hand column, and I've put some of the points in here. There's also some articles that kind of go through what's actually in that bill. The other bill is the Save America Act, and it looks like the House is moving to take up and pass that act next week. And there are a lot of voting advocates that are very concerned that that particular bill may pose a huge barrier to many people who don't currently worry about whether they have the right to vote. So we will prepare to talk about that in coming weeks, but the idea of who should be overseeing and controlling elections, and for that to be less controlled by the state and the federal government to have more of a control, is something that we have really heard being talked about much more in the last week and a half than we have before. In addition to these pieces of legislation, the president is continuing to repeat the false claims that the 2020 election was fraudulent. The results weren't correct. That was the election that he did not win. President Biden won. This week, the FBI conducted a raid and took a lot of documents and election machines from Georgia about the 2020 election. This morning, there was a story that the FBI was calling a meeting with state election officials, which is highly unusual. The messaging that is continuing about elections is that somehow there is election fraud, and that's the reason why the party that is not in power now is winning. And they wouldn't win if, there were legitimate voters only legitimate voters were allowed to vote. I mean, some of the rhetoric that is being discussed right now is really trying to tie that the elections are results are faulty if the person that we want to win doesn't. And the president has been very clear in the last week about saying that the federal government and the party that is currently in power should be in charge of running elections, not the states, which is not how this country has organized itself at all in its 250-year history. So be prepared that we may have to talk about this more than we have in the last year. There's kind of been a lot of buildup, but the right to vote and the ability for people who are impacted by public programs to have a say in who represents them in decisions about public programs has traditionally been a very important issue for people with disabilities and older adults. And many of the items that are often talked about in terms of controlling election fraud actually end up being barriers for people who have the hardest time, say, getting transportation or having a photo ID, or again, proving that they are, able to vote. So a lot of similar themes in terms of if you create a process that is hard for people to navigate or requires a lot of time and proof, that ends up meaning there are people who are eligible to vote now who end up not being able to overcome those hurdles. So moving on to the administration, um, it's it's difficult to kind of follow issues over the course of a year, but you may remember last March, the administration attempted to fire half of the Office of Civil Rights attorneys in the Department of Education. Since then, they have, lots of other things have happened. So we're going back to an event that happened last March and analysis of what that attempt to fire those people actually cost us. Now, the courts have blocked these firings. I think there's cases are still ongoing. And for 9 months, the department basically said, we want to fire these staff. We don't want them to come to work. And because the court said we couldn't fire them, I guess we have to pay them. So they put them on they made a choice to put the staff on administrative leave and continue to pay them while the court was resolving the case, which is still ongoing. During the shutdown, they brought some of those people back to work who they still want to fire, but then said, well, we're going to make you work while we're waiting to see whether we can fire you or not. That 9 months of putting people on administrative leave cost us, the taxpayers, about $28 to $38 million. And during that time, when you didn't have those 247 people doing the work of the Office of Civil Rights work, almost 90% of the complaints that came to the Department of Education were resolved because they dismissed the complaint, meaning the staff got the information that there was a complaint but did not investigate it any further. And dismissals happen with frequency. Sometimes it's warranted, but the Government Accountability Office was quick to point out that there does seem to be a difference between how this administration handled these complaints in their first term as opposed to now in their second term. So now there's 90% of the complaints being dismissed. In the first term, it was 81%. And they went back to a term before President Trump was in power, 2010 to 2011, and found that the rate of dismissal was 49%. So it's a pretty big jump. It's a big jump between what a previous administration did and the first Trump administration. And it's a big jump in terms of what the second term is doing versus the first term. Um, they also had a fact in there that during the first term, there were many more resolutions to disability discrimination cases than there are in the last year. So it tells you where the administration is putting its priorities and what this lack of staff is actually doing in terms of resolving complaints that are occurring, to students with disabilities across the country. We've covered this issue before, but there was a nice Wisconsin Watch article and a national blog on this. And it's important to keep understanding that there are lots of cases that are being considered by courts that are in various stages, and there are lots of issues that are unresolved. For right now, federal immigration officials cannot access personal data on every Wisconsinite enrolled in Medicaid. There are some people who are saying, well, maybe that's not happening, but that's what the court has said at this moment. And there's 21 states that are in that same position. These are the states that have sued and said, hey, we don't want the federal government having access to our Medicaid data to be used for this purpose. Other states that aren't part of the suit, federal agents, I think, are allowed to access this information. And this is important because even though people who are undocumented are not allowed into Medicaid, everybody has to be served in an emergency. So lots of folks are seeing this as access to Medicaid data being a pathway to look for people who are using emergency medical care, and also a pathway to perhaps see citizens who are eligible for Medicaid, like children, and find families where there are mixed statuses in here. So it's this case is ongoing. That's why it's happening. But it's also important to remember that it is super unclear how the Department of Health and Human Services can separate the records of undocumented people from those of immigrants with legal status. And we've talked about how when you start using data sets that were never intended to be used for certain purposes, the opportunity for mistakes is pretty high, as well as the opportunity for data to look like it's showing you one thing and be incorrect. And there's certainly a real reason to say in this particular data set that you may be targeting people who are legally here in your attempt to look for folks who are undocumented. There's been a lot more news on vaccines lately. Last week we talked about an entire committee that was supposed to advise the department about vaccine efficacy. That's a weird term that means how well does it work in terms of preventing or reducing how sick people get, either reducing disease or preventing disease, or making it so if you do get the disease, you get less sick than you would have if you didn't have the vaccine. Now that the secretary has replaced the full committee and replaced them with people who are very skeptical of the value of vaccinations. These are all folks that seem to share, opposition to the idea of vaccines in the same way that the secretary has. They are changing the charge of the committee to be more focused on investigating whether or not the vaccine causes harms, most vaccines cause side effects in some people. Many cause many of those side effects aren't necessarily severe, and some people don't have those side effects, but every vaccine has a small proportion of people that has a side effect. And it looks like they're really reorienting the committee to be looking at vaccines through the lens of does it cause any harm versus whether the vaccine has an overall public health benefit for many people. And there are lots of public health experts that are very concerned that this kind of shift in focus means that the benefits of vaccines could be kind of set aside and only, people's fears or people's worries about, side effects could be kind of elevated as to be the only thing that is talked about. For a long time, we have heard um, generally that there is concern among parents and people with disabilities that when they interact with law enforcement, sometimes law enforcement may not recognize the behavior that they're observing could be due to a disability. This is a long-standing and kind of challenging issue because law enforcement are, trained to be observers, and they see something that looks different, and they don't necessarily know what that difference means. However, there have been an increasing number of stories, specifically about Immigration, Customs and Enforcement and Border Patrol, that are not behaving in ways that many of our law enforcement friends do. There are lots of examples of law enforcement where things go not quite right, but there's also lots of examples where law enforcement is used to dealing with large segments of the public, some of whom are not having their best day, and they engage with people who have substance abuse and mental health disorders and disabilities and other things all the time. There's a familiarity with interacting with average citizens. But what we're starting to see with some of these federal agencies is different. And there's not only a lack of accommodation, but also a kind of framework around disability that is very different than law enforcement would be. So this particular autistic person in Minnesota, I believe, has a court case that is pending. And, she was essentially grabbed out of her car and then taken to a facility and, um, continued to receive mistreatment there. And was told, hey, this wouldn't be happening to you if you were normal. There have been also a couple of incidences where people who are deaf and maybe not able and unable to hear commands have felt either targeted when these agents have recognized something wasn't being perceived, or subject to much harsher treatments because they're not following a command that they cannot hear. So this is again something that we are paying attention to, but there is a theme here where the attitude and how people with disabilities are being thought about, this is also being seen in the language that many other decision makers are using. The increased use of the R word, for example, by public figures, and some of the ways that some of the research is being talked about and people with disabilities are being talked about. This is another extension of that. And the CMS director there were a number of shows that he was on this week. I've put one clip in here. This quote is actually from a different interview he did. But I want folks to understand that they are drawing a tie to fraud, autism services, and blaming moms for the fraud in a very tight framework here. First of all, none of this is substantiated. There is maybe an increased use in autism services. The question of why some people who were unserved are getting services. There's also a misunderstanding of how Medicaid works. The parents are not getting payments. It's the providers providing the services who are getting payments. So the idea that somehow use of a certain disability service is an indication of fraud, and that the person who's committing the fraud is the family member of the person receiving services. That's what this statement is trying to connect. And none of that is how the system actually works. You have to have a diagnosis, be qualified for the service. Somebody has to approve that plan. You have to find a provider. The provider is the one getting paid after they deliver the services. There shouldn't be any payments that are going to the family member. Like there's no reward for signing up for autism services. And I think it's really important because this is a public figure who runs Medicaid. That's his job. And he is out there talking to multiple outlets in this manner, in a way that frames people who are using autism services and their families as fraudsters, and doing that in a way that is leading people to believe that something needs to change, and that something is probably, reductions in autism services. Like that is a logical throughput. In December, likely the last report, at least for a while, that we will have about food insecurity was released. Every year for the last 30 years, USDA, the Department of Agriculture, has released a pretty comprehensive report trying to figure out how many people are hungry or at risk of being hungry in the country. And they usually collect data in December. They did not collect data in 2025. So this 2024 data may be the last annual survey on food security, and it's been done for decades. Without the 2025 data from last year, it's going to be very difficult to know what the impact was when SNAP benefits were withheld in November as part of the shutdown. And it's also going to be much harder for everyone to know what is the impact of the changes to the SNAP program made by HR 1 and the cuts that are coming to that program as food costs, of course, continue to rise. So this is another example of when you don't have the data, it then becomes very hard to kind of show cause and effect. And lots of folks are pointing out that the timing here seems like it is conveniently ending data and reporting collection before there are changes that most experts are going to say are going to result in millions of people losing access to food assistance. Idaho. This is really important. So I talked a little bit about tax cuts earlier that, again, Wisconsin is considering and that many states have kind of done over time. Idaho is one of those states. They've cut their income tax is 5 times in the last 5 years. And that means that each one of those tax cuts means less money is coming into the state to pay for things like Medicaid, transportation, education, public safety, core things that the states have some financial responsibility for in their state budget. So Idaho in the last 4 years has failed to collect $4 billion because they've decided that they're not going to collect that money. And that means that they don't have the revenue to pay for the things that they're currently doing. We talked about Idaho before because last week they were pursuing a initial budget cut of $45 million and proposing cuts to home and community-based services as part of that $45 million cut. This week, they are pursuing a different bill that would essentially conform their state statutes to all of the tax cuts that were included in H.R. 1. You might remember Colorado had that in place already. So when H.R. 1 passed, all of their statutes had to shift to match the tax codes at the federal level, and it resulted in a big, again, revenue decline for Colorado. So Colorado did its first rounds of cuts in August, and it did include cuts to Medicaid. It is now in a second round of cuts. In this case, Idaho has done tax cuts for the last 5 years and now wants to do a bill that will, take those federal tax cuts and put them into the state statutes, and that will mean another $192 million less in revenue coming into the state on top of the $45 million in cuts they're already doing. Our colleague in Idaho put together some testimony for that hearing. I have a link to it in this slide. It's really worth reading because it does a great job of saying, hey, our current system that you are already cutting and that would have to be cut further if we add on to the amount of revenue we're not collecting is already not sufficient to help people in the ways they need. And she has a lot of different examples of people in parts of the state who can't get to their appointments or can't find a doctor or all sorts of things that I think would be very familiar to our community as well. On January 12th, Idaho's governor proposed a list of cuts to make up for less revenue coming into the state. It included removing all home and community-based services, as well as, other cuts to Medicaid on services that are used a lot by people with disabilities. So it isn't only eliminating home and community-based services because those are optional. It is also removing other services that might be outside of that package that happen to disproportionately serve people with disabilities. Pharmacy benefits, dental, physical, occupational, and speech therapy, in-home nursing. And the stated reason for those targets is because those services are optional under federal Medicaid law. So for all of you in the past year who were told by elected officials, don't worry, the Medicaid cuts in H.R. 1 won't impact you. Here is the first sign that absolutely it will impact you, because the first place Idaho is going is the budget line where the most people who have the highest cost needs over the longest period of time are home and community-based services. So folks who have heard that from your elected officials at the federal level, oh, these cuts won't harm you. Here's a way to say, yes, they will. Because even though you didn't direct the cuts specifically to people with disabilities, you created the budget conditions that are resulting in states cutting exactly the things that people with disabilities rely on and that they can't get anywhere else but Medicaid. Kaiser also has a handy little tracking device for those of you who are following the work requirement pieces that will be applied to Badger Care in this state. We do think that those will impact people with disabilities and especially unpaid caregivers and paid caregivers. So there's there's kind of two different methods that states can use to impose those requirements early. And Nebraska is amending its state plan to do that, and they will be implementing in May of 2026. There are also states that have applied for that as soon as the new administration came in, they applied for waivers so that their state could do work requirements. So a number of them have applications there. And if they wanted to implement early, that's a way that they can do it. Some of these states may not be pursuing their waivers because now we have kind of the federal law outlining work requirements in HR 1. But you can kind of see who are the players that are in a position to be early adopters. And the page, if you go there, has some pretty detailed information about what each of these states was proposing in its waiver on how it wanted to implement work requirements. There's a lot of money that's to be made when it comes to implementing work requirements that could be the reason why people lose their Medicaid coverage. And it's important to know that there are technology companies that stand to have a lot of money coming in for contracts with states. And, not only to change their systems now, but to keep updating those systems and maintaining them in the future. So some of the changes that HR 1 is causing states to do, they require money to be spent and they require states to continue to spend money. And it won't be state workers who are getting those paychecks. It's going to be private sector companies who have contracts with those states. Some of the names will be pretty familiar. Some of them are involved in other sorts of federal contracts. But I think it's important for folks to know that as we're cutting $1 trillion in Medicaid, that does mean that there are other people who are getting a pretty big profit and pretty big bump in their incomes because they are the people who will help states meet those requirements. And lastly, this is kind of not particularly a reconciliation bill result, but if you have ever had trouble finding a provider who will take Medicaid, this should give you some validation. At the time that we are cutting Medicaid and that states are starting to make huge decisions about what they will cover, like Idaho, saying home and community-based services, it's important to know that we already do not have enough capacity to truly serve the people who are already in Medicaid. Only about 74% of doctors accept new Medicaid patients, and very often people will talk to us about how many calls it takes they have a list of people who accept Medicaid, how many calls it takes to find somebody who's willing to accept a new patient. Now there's new research that finds that even amongst the physicians that do accept Medicaid patients, there are some who rarely see them. So especially in specialty care, almost a third of the doctors who say that they are accepting Medicaid as a payment source, almost a third of them didn't see any Medicaid patients, and another 10% treated less than 10. And in some specialties, there were almost 40% of doctors who said they accepted Medicaid and saw nobody in enrollees. So I think that this is important in terms of as Medicaid gets cut, yes, we can have people who lose their Medicaid coverage, but also one of the ways Medicaid can be cut is by cutting the rates paid to providers. And we already have too few providers who are accepting Medicaids and lots of them who say they'll see Medicaid patients who don't. So if their rates get cut, this particular problem, it feels like this gets worse. And with that, I will stop.
All right. There were a couple questions in the beginning about, like cuts to Medicaid and what's that going to do to provider rates and some of that. And, like again, it's an unknown. I think one of the questions was, can they cut the rates that they already put in our budget before that next budget cycle? And, I said, probably not, but again, it's an unknown, right?
Well, I
Um,
mean, I don't want to nerd out too much,
yeah.
but that's what you're here for. Um, the state budget passed and it had the rates it was supposed that the state promised to pay. Okay? When we talk about there's a shortfall in Medicaid, it means that the amount the state thought it was going to pay is different than what the costs actually are. Okay. And that typically happens in Medicaid where they are trying to estimate how much the program will need based on old claims data, right? And some other factors. So that in itself isn't usual to be kind of off. It's the reason we have a special education, like it's a very common thing where you are looking at old data and you underestimate how much something is going to cost. So the rates that are in the current state budget will stay until they are changed. And there is a process where if you are too much in the hole, if your current budget is way off, the legislature could come back in and do what is called a budget repair bill.
Hmm.
And the job of a budget repair bill is to say, we radically have, the last time I think I remember a budget repair bill was 2010. Um, but the purpose of that repair bill is to say, oh, our last budget, we were way off. We promised to spend much more than we have. And so a budget repair bill is designed to make decisions to balance that budget. And if you're paying, if you have, too many costs for what money you have, you are cutting those costs. So yes, the rates are what they are in this budget. However, it doesn't mean that the whole budget isn't far enough off where a legislature might not have to come back in and do something about it before the next budget. What has been more typical is that when you have a new budget, so this is, January of 2027, the new legislature comes in, they are going to be talking about what do we do in the next budget. And that is the point where I think we should expect that the conversations about, you know, what, how much money are we expecting to spend? Where are we losing federal dollars? Where are we, where are we spending more than we thought will come into play? And that is, has been kind of a predictor of are you going to see cuts or not? What
Hmm.
those cuts are a matter for the legislature and the governor to decide, right? And advocates to try and influence.